What are we going to do with the 4 million people if the tax credits on the Affordable Care Act are not reinstated? And that's about what, out of the 24 million people on the Affordable Care Act, there's probably 4 million people that's really going to affect. And here's the thing I really don't like about politicians. They don't sit there and take the time or imagination to ever solve a problem. Their answer is, give us some more money, give us some more money, over and over and over. It's like, okay, let's come up with a different idea. What you could do, if you actually thought about it from an insurance standpoint, is you could take those 4 million people and you could form a large insurance group. A large insurance group is 50 people or more. You would do a self-funded plan. You would get what's called a third-party administrator. A third-party administrator is somebody who handles all the bills. And you'd get what's called a transparent third-party administrator. That is somebody who's incentivized to actually lower the cost. You get a transparent pharmacy benefit manager. All of a sudden now, you could turn this group around and you could drop 30 to 40% of the cost. So instead of being on the Affordable Care Act and the prices going up every year, you could do what's called a Health Rosetta plan. And Health Rosetta is a health group that does this over and over. So you can do the same thing. There's companies that have had their premiums frozen for 6 years. There's companies that have holidays where they say, you know what, our plan's doing so well, you don't have to pay part of your premiums to the employees. So there's a lot of things that you could actually do that lower costs. Now, a lot of these plans, when you do this, guess what they don't have? They don't have deductibles. They don't have copays, coinsurance. It's real insurance. Well, what they do is they manage the cost. I'm sick of messing around in healthcare. I want one bill. Let's make this simple. Now, why doesn't the government want to do that? Well, imagine if you did that for 4 million people. All of a sudden, the other 20 million people go, wait a minute, I'm on this plan over here. It's not very good. I have these deductibles, calling United, I'm calling Aetna, I'm getting on these 1-800 numbers, talking to somebody in the Philippines, the call drops. Why can't I get on this real good plan? That would destroy the power of the politicians. Because when you cut 30 to 40%, you know what you don't have? You don't have lobbying dollars. Politicians aren't getting paid. What happens is we're getting great health care. The doctors are getting paid quickly. And if you pay doctors in cash, you can pay them a lot less. We're happy to take cash pay that's a lot less. Those are the kind of deals you can get. But you need somebody who cares about your health and is willing to look for it. So Congress, Senate, let's start doing your job. You want to get involved with it? Give people good health care.